Welcome to Empowering Seniors. I'm your host, Katherine Ambrose. Today we're going to talk about a very important topic, Home Health 101, so that you have a great understanding of what home health is and how it can help you or your loved ones remain in your home. Michael Stratton is our guest today. Michael, a speech pathologist with Providence Home Health. We're so happy to have you on the show. Thank you for joining us.
Well, thank you so much for having me and for having Providence on the show. We're very happy to be here and happy to share a little bit about home health, because I think it's something that a lot of people have questions about, and maybe there's some misnomers or some stigmas about it that maybe we could clear up today.
First of all, Michael, a speech pathologist, what is that?
Well, I'm glad you asked. I have a lot of people, when I call to set up appointments with them, they'll say, I don't know why you're calling me. I talk good. Of course, I'll say, I'm not sure about that. Maybe we should explore that a little more. But a speech therapist in the home health setting works a lot on cognition, safety awareness. We also are swallowing experts, if you will. I'm not sure if anybody's an expert in anything, but I'm highly trained in the swallow function. So I want to make sure that people are able to swallow, able to eat what they want to eat for as long as possible. I know for me that's a big thing, because I don't want somebody taking my ribeye away from me. So I work a lot in assisted living settings as well, also in memory care settings. Probably about 50% of my caseload will consist of individuals with dementia. And so I work a lot with family on communication strategies so that they can continue to speak, to communicate with their loved ones without the frustration that oftentimes comes along with that disease. So just a snippet, I suppose, of what we do in the home health realm.
It's so amazing, because you would assume speech pathologist just means talking.
You would.
And you're so right how important swallowing is. And then the cognition and the other things that you do is surprising. It's not really part of the title. And so I'm glad you're sharing that with our audience on how valuable a speech pathologist is and the role you can play as we age and age in place. So in home health, how does that help people stay in their home longer, stay in the environment that they want to be in?
Well, I'm glad that you mentioned aging in place, because that really is our goal. We want to help people stay in their homes or wherever they're living at the current time. I've never talked to a patient that said, I can't wait to get to that nursing home. We want to keep people where they're at. So home health involves many different disciplines. We've got nursing, and what nursing does is they help with disease process. What I hear a lot of patients say is, I went to the doctor gave me a new diagnosis, left the room, and here I am. I don't know anything about it. I'm very scared. So our nurses do a great job of going and educating. What does this individual need to expect as this disease progresses? Nursing also helps a lot with medication management, and I'd like to touch on medications briefly. What I hear a lot of people say is, I take the medicines that my doctor gave me. Many of us have a primary care physician. Oftentimes people have a specialist. Some people have several specialists. What I educate those individuals on is that generally those specialists and the physicians, for the most part, are not talking. They aren't communicating. They don't call and say, is it okay if we put Mrs. Smith on such and such? So it's really our job as the patient to know what our medications are, what the side effects are, and then if there's any contraindications. In other words, is one of the medications working against another one of the medications and causing issues? So that's what nursing does.
So then you can clear that up, maybe help the communication between the different physicians.
Absolutely. So our nurse will call the physician and say, well, we understand that you prescribed this medication. However, this patient is also on this medication. Is there something that we can look at differently? Can we go a different route? So one of those things that oftentimes we just don't think about. I work with a lot of people that say, I take it because the doctor told me to. And that's understandable, because that's kind of been the way we've done it for so long.
It's kind of like doing what we're told.
That's right. But I also tell people, if you want your medications reconciled, in other words, having somebody look through them, you can request it from your
PCP
pharmacist, your pharmacist. Some pharmacists are getting really good about looking into those if you request it. So just one of those things. That's kind of what nursing does on a small scale. They also deal with wounds and help heal wounds so that people can get back on their feet, get back to doing the things that they enjoy doing. Then we do have physical therapists. Physical therapy, what I tell people is generally they work everything from the waist down. Well, they do some upper body stuff, but their main goal is to keep people upright, to keep people balanced, or if we've got somebody who's in a wheelchair, we'll help with transfers. What's the safest way to get them up and out of that wheelchair into another setting?
Because there are easy ways that family caregivers can learn also to help people transfer and how to assist without wrenching your back.
Yes.
There's some very simple techniques that home health people could help you learn.
Absolutely. And without the training that these physical therapists have, it's one of those things most people don't know about.
For sure. And so, but once you're exposed to some of the proper methods, it makes sense.
Absolutely.
Rather than trying to figure it out on your own, get some training from the people that have been trained. I want to talk about the physical therapist for just a second too,
sure.
because I'm a big advocate of getting with a PT, getting with a physical therapist when you've experienced an injury and maybe exercises would help you get better faster, but also rather than just pick up a cane at Walgreens or wherever you want to get a cane or borrow it from a friend, that you have a physical therapist maybe look at it and adjust it so that you have the right height.
You've met Pam, who's one of our liaisons. She actually goes out and educates physicians on this, because what we do hear a lot is, the doctor told me to get a walker. So they listen to the doctor and they go get a walker, or son, daughter, who have family member gets them a walker, but they're not fitted to it and they're not taught how to use it. If you've seen people with walkers walking with them way out here, or walking up close with them, shuffling their feet, looking down at their feet, these are things that physical therapists train individuals on. So
you could age faster.
Yes,
You'll
and
age
safer.
faster.
Yes.
And it's not as safe if you don't get the training.
That's it.
Because the doctors are there to prescribe medication, oversee your care, surgery.
Yes.
But there's many other people that you could use as leverage that can help you do things correctly, follow the doctor's orders correctly.
Absolutely. And one of the things that we are really trying to educate individuals on is, if you've got a surgery coming up, let's say an individual has a total knee surgery coming up, let's do some physical therapy a month or 2 months beforehand, get them as strong as possible, so that rehab afterwards, that time is much, much shorter.
Less painful.
Absolutely. Unfortunately, a lot of the people that we see are people coming out of the hospitals. We're trying to be very proactive and letting people know you don't need to wait until you have a fall and go into the hospital. If you're feeling a little weak or unsteady on your feet, give us a call and let's see if there's something we can do now to avoid that hospitalization. And there's a lot of hospitalizations that really could be avoided. It's just an education issue, I think.
Okay, so because you're viewing this show, you can implement some of these things in your life and know to reach out to maybe a home health company in your local area, because we could have viewers anywhere in the country, but certainly all throughout Kansas. Reach out to a home health company to find out what kind of services might be helpful, and they can work with your physicians to get that treatment approved so it could be covered by your insurance.
Absolutely. So I'm glad you mentioned the insurance. You're absolutely right. We want to go, everything goes through the physician. So the physician's the one who signs the orders, gets home health started, and then we're always in constant communication, making sure that the physician knows where the progress is at. But yes, we have liaisons like Pam, who I mentioned earlier, and what she does is she makes sure that the physicians are educated. That's a tough job, let me tell you.
Because they're busy.
They're very
focused on what they
very,
do.
very, very busy. But she also makes sure that the individuals have the insurance taken care of, that they're not having to make phone calls and having, it's really nice to have those liaisons.
Very
with
good.
us.
What we're going to do now, Michael, is meet a couple of the patients that you've worked with and hear their story.
Perfect.
And then when we come back, we'll talk a little bit more about how you help with temporary issues and how you help with chronic disease management.
That sounds fantastic. I look forward to it.
Welcome Donna Cook. She's used home health and she's going to tell us what her experience is like. Donna, thank you so much for joining the show.
You're welcome. It's good to be here.
So how is it that you opted to use home health services?
It was after surgeries. And then, like I've had 4 major back surgeries. So anytime I stumble or, then I get them. But I've had them for my thumb, for my feet, for my back, and they are amazing.
And so you've had them just when you needed them, just for what, a few weeks at a time?
Usually it's about six
About 6 weeks.
Yeah.
Mhm. And how has it helped you?
Oh, it's helped me walk better uh, because I have a lot of trouble walking because my back hurts. But it's really helped me there.
And so what type of healthcare professionals have come to your home before?
Well, even Michael has come because I was worried because I was forgetting things, and I wanted to make sure I wasn't getting dementia.
Okay.
And he said, I'm okay.
You were worried about your memory, and he helped you through that.
Yeah.
Good.
Yeah.
And just provided you some relief, like, oh, okay, good, I'm not losing it.
Right.
Okay.
Right. And I've had John for physical therapy. I've had Janice for occupational therapy for my thumb. I mean, I've had pretty much it all, really.
It sounds like you've gotten an education in all the different types of experts.
I really have.
Yeah.
Yeah.
And did you ever have any hesitation about letting healthcare people come to your home? Did it seem strange at first?
No, they're very friendly. They're just really good to work with, and they're always there. And if we ever need them, feel like you need it or whatever, you just give them a call, and they'll come and check everything out.
What would you like people to know about why it might be important or why it might be beneficial to call?
Oh, definitely. As you get older, you get weaker, more wore out and stuff. It definitely makes you stronger in your body. It really does. And that's what we need, is to be stronger and be able to walk and do things that we enjoy.
Were you ever fearful that you were in such a state physically that you weren't going to get better?
Oh yeah, definitely. With my back especially, it just goes on and on, but no, it's...
And now look at you today.
Yeah.
You got your life.
Yeah.
Very good. Well, thank you for being on the show, Donna.
Thank you. It was nice to be here.
Now let's meet Patty Hoekstraw. Patty, thanks for being on the show.
Thank you. It's so fun.
It's awesome to have you. So tell us how home health benefited you. What was your experience?
I learned about them in our independent living. They come and give presentations. They were doing one on pain. I just had been diagnosed with carpal tunnel, severe carpal tunnel, and bone-on-bone arthritis. I was given a brace to wear, and I was kind of afraid because I just wore that brace for many months, and I'm losing function with my hand, and I can't hold anything. Well, I asked them if there was anything we could do with pain from arthritis in my wrists. Immediately, they set me up with home health care that came to my independent living. Joyce was my nurse, and Jeanette was my occupational therapist. Wonderful people, very friendly, very warm, very prompt, and very professional. And they really helped me to combat that pain and the use of my hands. It was really good because it was before pre-surgery on my carpal tunnel. And so like they said, it strengthened my hand and stuff to be able to go into that surgery better.
And have you had other home health services?
Not yet, but I'm sure that they will be on my calendar in the future.
So, but now you're very comfortable with them.
Very.
And you know that they can help you with anything.
Yes.
So what has it been like talking to your physicians to get home health approved?
Actually, my PA, she just is for anything that help benefit your movement and your ability to live independently. So she is really pretty quick to sign on. She knows me. I've been her patient for a long time, and so she's very willing to sign me on to these. And it runs about 6 weeks usually for a session.
And so your surgeon that worked on your carpal tunnel, you and I had the opportunity to meet just a few minutes ago, and you said the surgeon thought you were all done and you didn't need that anymore.
Yes, the surgeon said that I really probably wouldn't need home health now, but I'm really feeling I do because I have some numbness in my hand. He said it'll go away in about 6 weeks, but I think with home therapy, because of my experience with them, that they'll be able to help me exercise and use that hand and get my ability back.
Because that therapy is beneficial.
Yes, it is.
Okay, good to know.
Okay.
Thank you so much, Patty.
Oh, you're welcome. It's been wonderful. People need to know this.
Now we're back with Michael Stratton, the speech pathologist with Providence Home Health. So Michael, that was so great to hear these real life stories and experiences. So home health can help you in your home, whether it's the home you live in now or maybe a home that might be a better place to age in place.
Yes.
Because sometimes it's not your current home where you raised your children, maybe in a 2-story, or the bathrooms aren't large enough to have people help you. And so where can you age in place best? So that's something that can be addressed. But staying in your home as long as possible is often the goal. You can help with intermittent issues, did I say that correctly?
Absolutely.
And also with chronic disease management. So tell us a little bit about the differences and what those are.
Sure. So with the intermittent, we do have individuals that will come back to us. They may have an issue with a foot, and so we'll go out and help them with the foot. And then maybe 6 months later, something will happen. They'll have something go on with their hands or their back or whatever it may be. And so the nice thing about home health is we can come out as often as possible as long as there's skilled need.
Michael, tell us, how can people qualify for home health services?
Well, to get started, of course, it does take a physician's order, but to qualify for home health services, the people that I talk to will tell me, I went shopping on Saturday. It took me about 45 minutes to get ready. Then I had to rest for about 45 minutes because it was a taxing effort. It was difficult for me. Or I went shopping for a couple hours on Saturday, and when I got home, I was tuckered out. I could not get it back on my feet for another 2.5 hours. Those individuals qualify because it's a taxing effort. And the reason that we want to get them on service is that shouldn't be a taxing effort. We want them to continue to go out and do the things they enjoy doing.
So I understand that home health can help with outpatient and also for homebound individuals. Can you address that?
So those homebound individuals, again, are the ones who have, it's a taxing effort for them to get out and do those things. Outpatient is a good alternative for individuals who don't have those issues, who maybe need some rehab but can get out, are doing pretty well on their own and aren't necessarily needing other people to assist them.
So when they first get out of rehab and come back home,
Right.
they can get temporary services to get on their feet faster.
And a lot of our patients we'll have on for 4 to 6 weeks, 8 weeks tops. But we do have individuals that we keep on longer because they're just more involved. So
I like the idea that you come in maybe for 6 or 8 weeks, and it kind of gets the person used to allowing services in the home so that if it's needed later, you've already done it. You already know what it's about, and it's not so intimidating.
Yes, it is hard for individuals sometimes to open their homes to new people and to assistance. A lot of the folks that I work with grew up in a tough time, and they were raised very tough, and asking for assistance is difficult. So yes, you're right.
But this is to keep
in there.
you tough.
That's right.
This is to keep you strong, keep you tough.
That's right.
And keep you having a quality of life.
Absolutely. Love the way you say that.
So you can help with temporary issues and also with chronic disease management. So can you address both of those?
Absolutely. So with both intermittent and with the chronic, we may see the same individual several times throughout the years. But it may be on the intermittent side, it may be due to different things. Maybe they had an issue with a foot and we've got to get somebody out there to help out. It's a wound, it's a diabetic wound or something like that. But we also do deal with disease process. I mentioned earlier how we have a lot of people that come out of the doctor's office with a new diagnosis. That can be very, very scary for individuals. That's why we send the nurse in to make sure that they understand what they're going to be looking at. Now, what we also do, though, is we help planning for the future. So we help with advanced planning. We help with placement if necessary. And I do have a lot of people ask, what's the difference between an assisted living and an independent living? And I like to tell them both will give you some independence, because even in assisted living, you've got some medical professionals there that are there to help, but you don't necessarily have people coming knocking at your door all the time bugging you, which I think is one of those stigmas that people have about assisted livings. But
Because that's not the same thing as what a lot of people might think of a nursing home.
yes,
So independent living and assisted living, that is your own home. Independent, there's not medical care
That's
wrapped
right.
in it,
You
but
got
you
it.
can bring in
you bet.
healthcare workers.
Yep.
And then assisted living, that's built in.
Yes, you've got the built-in health care. Now, as a home health, clinician, I can still go into either setting, which is very nice. And really what we do in the ALs is we act as a support system to those director of nursings, which is very nice. I do want to address cost, because cost is one of the things that I hear a lot about.
Of course, because people worry about outliving their money.
Absolutely.
And they want to know what's covered.
Yes, and I work with people on fixed incomes who say, if this is going to cost money, I'm sorry, I can't do it. And thank goodness it's paid for by insurance.
Yeah, because we want that quality of life.
Absolutely.
So we really want to encourage people to get all of the leverage, all of the help, all of the assistance, all of the care,
Right.
and the comfort and the therapy that you can possibly get, so you can age in place longer and you can have a happier, longer, healthier life.
Absolutely, and that's what we're going for. So if we can get a service like home health paid for an individual through their insurance, which it generally is paid for, why not? It's nothing but a benefit. Unfortunately, not a lot of people know it's paid for. Not a lot of people even know about home health. These insurance companies, unfortunately, are not sending out postcards saying, hey, use this service, we'll pay for it.
Yes.
Imagine that. So that's one of the reasons we do all the education with Providence that we do. So.
Okay, well, very good. And so there's a lot of companies like yours all across our city, all across our state, all across the USA, and true professionals that work together in a unit. I want to talk a little bit about cognitive evaluations. What is it that a speech pathologist can do in terms of that?
Sure. I've got several different types of evaluations that I can give. As far as the cognitive, really what I'm looking at is lots of different characteristics. So I'm looking at safety awareness, problem solving, short-term memory. Short-term memory is one of those things I get asked a lot about. I'll have patients say, I'm starting to forget things, do I have dementia? I always like to make sure that I let people know all of us that are blessed enough to live long enough are probably going to have some short-term memory deficits. We have atrophy to our muscles. The same thing, unfortunately, occurs to our brain, the dying of the cells. And what happens when it affects the brain is generally the short-term memory is affected. So those of you out there that think you have dementia, let's do a cognitive evaluation first, and don't get too panicked about it.
They might be thinking, yeah, but what can you do?
Right.
There's no hope.
Well,
it's just going to get worse, and I don't want it. I don't want to know. I don't want people to know. Why is it important to be engaged? Because there is things that can be made better.
There is, and when we talk even short-term memory, let's talk about medications. I tell people, if you take your medication this morning at 8 o'clock and you wait until 11 o'clock tomorrow morning, you've got that 3-hour span that is not in your body. It's not doing what it should be doing. That's when we do see a lot of issues, a lot of medication issues. If you don't have the memory to remember when you're taking those, that can be a big issue. So little things, little tweaks that we can make in the home so that
make
those
a big difference.
so they can
and
stay
a lot
there.
of times maybe it's not your brain that's
Yes.
having an issue. It could be this medication.
Yes, absolutely.
And so you can get some explanations
Absolutely.
for that and get some tips on how to make it better.
Absolutely.
I just think it'd be such a wonderful thing to have someone like you come into our homes and help us with these simple things to make life better. And knowing that there's so much coverage that people have with their Medicare, and take advantage of it.
Absolutely.
Because that's why it's there, and that's what you've paid for and invested in.
Absolutely.
To have somebody like Michael Stratton come into your home and help.
Thank you so much. I appreciate that. And yes, call us, or at least call a home health provider in your area and see what they can do for you. It's absolutely worth it.
I believe this is helpful for our viewers.
I hope so.
Michael, thank you so much for being on the show. And thank you for watching. I hope this was helpful. And if you have questions about home health, downsizing, aging in place, any of the topics that we cover, will you please reach out to us at empoweringseniors@kpts.org for email, or call us at 316-686-4500. I'm America's Senior Home Coach, Katherine Ambrose, and I can't wait to see you on the next Empowering Seniors.